action.
Hi everybody, I'm Mimi Ellis and this is Dr. Julie Zweig, and today we're going to demonstrate how to place your Freestyle Libre 14-day continuous glucose monitoring patch. So this is the prescription box. You should have something that looks like this, and if you're not diabetic, you want a 14-day monitor, not the newer Libre. The Libre 2 has alarms on it, and you don't want that one for our program. So this is what you're going to start with. When you open your box, you're going to have two containers that will look like this. I'm going to set them down. And you will want to get a couple alcohol wipe pads.
Can you use just plain alcohol, rubbing alcohol?
Yes.
The cotton ball?
Yep.
Okay.
If you don't have the alcohol pads, just rubbing alcohol on a cotton ball works great.
Good.
And then you want to pick which arm you're going to use.
I'm going to use my non-dominant arm.
Your non-dominant arm, okay. And then you want to go on the back of the arm where we've got, not right in the muscle, but about 2/3 of the way down toward your elbow is where you're going to want to place your patch. And first you're going to clean the area with your alcohol wipe. I have already washed my hands. I'm going to use the other side of it and do one more. Okay, we're going to let that sit and dry for a minute. Oop, and there I go, right in front of the thing. So you're going to have these two containers, and you're going to peel the top off of this white one, and you'll see something like this. Set that down, and then on your other one you're gonna unscrew the clear cap off of here so that you're left with just this blue part. And I'll show you quickly the inside of this. This is the actual patch. This is the skin side, so this is what's going to stick to the patient. And then you are going to put the top part into the bottom. And you can see how there's a little line on both of them, and you want to line those up. There's actually a little notch on the blue part. You want those to line up perfectly, and then push it together till it clicks like that. You can also use a hard surface to push it down. Then you're going to pop this out, and now you'll see that the patch is in here, and you will see a teeny tiny little needle there that you will barely feel, if at all. The needle does not stay in your arm. It just makes a super fast little hole for the monofilament that's actually going to be measuring the glucose in your what's called interstitial fluid. That's the fluid between your cells. So the monofilament is what stays in. The needle does not stay in, and really you'll barely feel it. Most people don't feel it at all. So here we go. Once we have this ready to go, we're going to be placing the blue, the open part of the blue circle on the site that we want the patch to go. So that's going to be right here. And we're just going to apply some firm pressure. Ready? 1, 2, 3. And there we go. It is on. And it is nice and stuck. So I like to cover this with a clear waterproof dressing. You don't absolutely have to, but it makes it a lot easier to get clothes on and off and just not worry about if your patch gets wet.
Great. And then after we get the patch on, how do we link it to our phone? What do we do next?
So two things will happen. You'll want to look for an email invitation from your provider from Freestyle Libre to create an account so that they can wirelessly look at your glucose levels. And then you are going to just get your smartphone or your reader. If you have an iPhone 7 or above, you should not need to purchase a reader. And you're literally going to just follow the directions after you download the Freestyle Libre app. And it'll show you how to pair the patch with your phone. And at least 3 times a day, you're going to basically open up the app, scan using your phone, scan your patch, and it will give you up to 8 hours of data. So I always tell people do it 4 times a day. That way you're not missing data. Do it right before you go to bed and as soon as you wake up, so that we capture as much of the data during your sleep as we can, because we want to know about the sleeping time data as well as the daytime data.
And Mimi, thank you very much. That did not hurt at all. And I do have a question. So what do we really use this continuous glucose monitoring for? What are some examples of why we would be using it?
Great. We'll talk about that very quickly. We are not an endocrinology practice, so if you are diabetic, having us monitor your glucose is not the right thing to do. You definitely want a certified diabetes educator or your endocrinologist doing that. But being that we are in sleep medicine, ENT, integrative wellness, we use this for patients that are having ongoing sleep issues, chronic pain, insulin resistance, pre-diabetes, autoimmune conditions, even anxiety and depression have been shown to improve with tightening our blood sugar control. So the cool thing about using a device like this is that you get immediate feedback from the lifestyle choices you've been making throughout the day. You know right away what you can get away with and what you can't get away with, and everybody's very different. So using things like glycemic index or glycemic load, you know, these kind of cookie cutter estimates of how we metabolize things don't allow us to get our glucose levels as controlled or controlled as tightly, and studies have shown that when we can get it controlled more tightly, all of the things we just talked about can improve: chronic pain, depression, anxiety, insulin resistance, even things like cholesterol and triglycerides and blood pressure will typically improve when we can master our metabolism this way. So it's a really cool tool, and it's very cost effective, and it really puts the control of your health right in your hands.
Wonderful. And I just want to reiterate one thing that you said, that we're all different. So if we eat the same thing at the exact same times of the day, we might have completely different readings.
Yep.
You and
Yep.
me. So,
and we've shown that. We've actually shown that with clients where literally I ate the same thing as a client, and my client was texting me frantic going, "Why did I spike after this?" And I, didn't have the same reaction. It's not a contest, guys. Everybody's going to be different, but it gives you the ability to change what you're doing pretty quickly, usually with just a few simple modifications, without over restricting other things that you may be restricting now that you don't need to also. So it can give you a lot more freedom.
So you could actually look at what happens if you eat a protein meal or a meal with a lot of protein, and then you might have something that's on the sweeter side, and how your blood sugar reacts to that.
Yep.
Versus going after that sugar substance without that protein in your body.
Right.
Yeah.
The gluten-free, store-bought, too sweet muffin on the way to work with a cup of coffee and no protein. Yeah, that got me.
I understand. Well, I'm really excited to try this, so thank you very much.